Welcome to the 81st edition of Pod Universal, India's first and leading pod magazine published by Prime Point Foundation. I am K. Srinivasan, editor of Pod Universal, welcoming you to the show. In this edition, we feature Medicall 2009, which was inaugurated on 31st July 2009 at Chennai Trade Center. This three-day medical equipment expo is the largest of its kind in India, with more than 250 exhibitors, including 8 Chinese exhibitors, displaying the latest medical equipment and hospital needs under a single floor. Seminars are also being held on patient safety issues and hospital construction, with eminent global experts sharing their views. Please listen to Dr. Manivannan, CEO of Medicall, the organizers of this grand event.
Medicall 2009, this is the 4th edition of Medicall. We started in 2006. After all 3 editions, this 4th edition we have around 250 exhibitors from all over India exhibiting various equipments and products which are necessary for a hospital. In fact, people are fondly calling this as a hospital needs supermarket, as they are able to get A to Z requirement of their hospital. We have been conducting this show for the past 3 years, and this year we are expecting around 5,000 hospital owners to visit the show from all over India. We have very interesting seminars for the doctors also. We have interesting seminars on hospital management and hospital construction, seminar for sterilization products, and we have a very interesting seminar on patient safety, because patient safety is a very important integral part of current day hospital practice. And we have invited distinguished faculty from all over India to speak on this particular topic. This year we have very interesting products like new ambulances, new furniture which are manufactured in India, and garments which are manufactured which are infection resistant garments. And we have Chinese exhibitors and Taiwanese exhibitors participating in this show for the first time. They are displaying various types of patient monitors and other equipments needed for mother and child care, which is the first they are introducing for the first time in India. So all the southern state governments have introduced a universal health scheme which will benefit more than around 5 to 6 crores of population in the southern states. Earlier, these populations were not affordable for high-end medical treatment offered by private healthcare. With this insurance scheme, poor people, below poverty line people will be able to afford quality health care at private hospitals, and hence this will increase the demand for number of beds, and we expect more than 15 to 20% growth rate in the healthcare industry. Medicall will serve as a one-stop shop to purchase all their equipment so that they can be ready to treat all these patients in their hospitals, and in that way this will benefit both the exhibitors as well as the visitors. Since they are able to get all these equipments in one place, healthcare industry is a recession-proof industry. In fact, in this recession period, this is the only industry which is growing at a CAGR of 15%. There is a huge demand-supply gap, and also there is a heavy inflow of medical tourists into India, and a lot of hospitals are going in for accreditation of their hospitals. Huge demand for all the medical equipments. Hence, we expect this exhibition to benefit a lot of hospital owners for their future expansions. In fact, a lot of health cities are coming in and around Chennai and many major cities. These health cities will be serving the national and international patients.
That was Dr. Manivannan, CEO of Medicall, the organizers of this event. We also spoke to an exhibitor from China. Please listen to Zia, International Marketing Manager of Lepu Medical Technology from China.
Hi, this is Zia from China, and this is our first time to come to China, India for exhibition. And we feel like the exhibition is organized very well, and there's not much crowd coming. So if there's more people coming in the exhibition, that would be much better. But we're satisfied so far with the exhibition and with the organization. It's a very good conference.
That was Zia from China, an exhibitor in this expo. We spoke to Dr. Muruganathan, member of Indian Medical Council and also the governing council member of Dr. MGR Medical University. Please listen to him now.
The Tamil Nadu government has introduced a insurance scheme for the benefit of poor people, and even the poor people can avail the facilities of the private hospitals. At the first phase, 300 private hospitals are approved by the Tamil Nadu government, which means all the 300 private hospitals will get more number of cases. So when you get more number of cases for a private hospital, the private hospital has to update, also equip the hospital adequately so that they can take care of this extra load. So this Medicall exhibition will be a real good supermarket all under one roof. So all the hospital owners can come and get their things and can see the updates. Even the latest equipments have come. So this will be very useful for all the private hospitals, especially after the government has introduced this insurance scheme. So all the other state governments are going to introduce this insurance scheme. So all the other private hospitals in other states have to equip their hospitals adequately so that they can tackle any emergencies, any problem.
That was Dr. Muruganathan, member of Indian Medical Council. Mr. Rajvi, a popular health journalist and a TV anchor for health programs, was one of the visitors for this expo. We asked his views. Please listen to him now.
India has got some good doctors, there's no doubt about that. But the fact also is that, see, unlike foreign countries where doctors every year or every 5 years, they have to keep themselves updated in CME programs and seminars, published journals. But here it doesn't happen like that. A doctor would have finished his graduation 20 years or 25 years, he was still happily practicing his profession. But the problem is medical technology is getting updated at such a fast pace. I mean, what was looked at with surprise and wonder 2-3 years back is now just ordinary stuff. So one needs to really understand the latest technology and innovation happening in the field of medicine. And unfortunately in Tamil Nadu, we have doctors who really don't keep themselves updated. This kind of exhibition will go a long way in understanding the latest technology, innovation happening in the field of medicine.
That was Mr. Rajvi, a well-known health journalist and a TV anchor. Thank you, listeners. Hope you enjoyed this part show. For more updates, please log on to poduniversal.com. Please send in your comments and suggestions to editor@poduniversal.com. This is K. Srinivasan, editor of Pod Universal, signing off from the show. Till we meet next, take care and bye.